management tools. And so once again, when we were looking at some applications for the dashboarding tool, denials management was one of those areas that we really saw that we can have some value. I think that you know, a lot of hospitals are affected by their claims denials, and it's a large aspect of their revenue cycle, but it's also an aspect that's very difficult to manage, not necessarily from the strategy standpoint, but the data getting it. So, I mean, a standard Google search will tell you that, okay, let's analyze your claim denial populations and understand the trends ahead of it. But the thing is that data is very difficult to organize, and especially displaying in a way that's useful and actionable. So here we had the Chief Operations Officer and the Chief Financial Officers, as well as some directors in the finance groups, to ask us to find a way to create some dashboards that would allow for the detection of trends and understanding how denials were being handled at the hospital, in order to really make sure that there's less denials coming through and less denials being written off in the back end, and the hospital actually not getting paid by the insurance companies. So if we look into the scenario here is, previously, the hospital was looking at some current populations of their claims denial populations, but the reports that were being generated weren't necessarily flexible and robust to filtering. So there was numbers being presented on this health plan, and for this reason is rejecting these insurance claims. But it was difficult for just any standard user to go and try to find exactly what they needed. And that also brings to the point that there was, a lot of different groups within the hospital that were looking to make some actionable decisions off of this data, so operational and strategy teams. And it was tough to make some flexible reports because of the nature of the data. So 835 and 837 data, it's not clean, it's highly transactional, and we really had to understand Cerner and how the data was located in Cerner as the EHR and their ProFit module, and see how we could paste and blend those tables together in order to have something that's actionable and produce trends. So in order to create our solutions, we wanted to, first of all, have just a way to be able to determine trends for the denials. And the process that we underwent in order to get there and create the dashboard tools was pretty extensive, really heavily involved with talking to various individuals in the organization who held the expertise, sat down several meetings with these individuals to completely process map out the revenue cycle and the denials management aspect of that, and get end-to-end documentation with the data flows in order to be able to piece together these tables and undergo the right technological transformations to be able to display the information. So, when we go into the demonstration, I think that some of the use cases that we found for the tool that we made, which I'll bring up in just a second, is it really allows for the analysis of problematic claims populations, first of all. So if you do know exactly what you want to look into, you can do that with the tool. But we also allow for the ability to detect anomalies related to the denials, and understand, hey, there might be a new denial reason that you have to attend to. Let's come up with a strategy to solve that. And then also, finally, something we focused on, another use case, was how individuals such as care management can work with the tool to understand how the hospital interacts with specific insurers. So often they'll go into meetings with insurance companies, and you want to have a data-driven approach to resolving issues and finding out what's going on with denials. So I'm going to jump into Knowi here and navigate to the denials tool that we created. Once again, this would be available in the embedded portal that we created for the client. And the page that loads here will show you exactly how someone who's logged into the tool would see things. And keep in mind that this is also data that has been manipulated to not be real, and it's pretty much dummy data. So jumping into it, this is the exact home screen that, as I mentioned, and you can see some high-level statistics, some time series data on the volume and transactions that undergo in the denials and for past 90 days. We have some population breakdowns between reasons, payers, health plans, encounter types, as well as clinical facilities. And this was also a huge win because previously the data was only really being analyzed in certain regards with the health plan and the reasons. So we're adding more populations, as many populations as we can, to allow for that exploration. And then, as I mentioned, one thing that someone can do here is they might want to look at, okay, give me all of the denied claims in the past 60 days that are for inpatient encounters and are related to authorization reasons. And so, as some of you might know, with insurance companies, they decide to report why they deny claims a little bit differently. One insurance company is different from the next, so it might be hard to bundle these reasons. However, with Knowi, you have filtering and say, hey, I want to give all the authorization-related denials in here to analyze them together. And so this search feature allows you to really bundle those in a really easy way and quick way. Not going to do that because I think we have other use cases to attend to. And the next one would be being able to detect anomalies. So we see spikes in days over here. And one thing that we can do is say, okay, I see a spike over here on August 15th. Let's go click into it and understand what's going on. And so this spike might be because a particular payer has processed certain reasons that day, or for some other reasons, but we can find that really easily and either find a way to mitigate that, or find a way to prevent that into the future by doing some simple root cause by looking at these graphs over here. So one thing we can analyze really quickly here is exactly what payer is accounted for the majority. Understand that this health plan looks like this amount was caused by relatively few transactions. So that's some good insight that we can gather really, really quickly here in a robust and filterable way. And then, finally, with the application of perhaps having a meeting with an insurance company, we could also click into a particular insurance company. For example, there are insurance companies that the hospital does work with more frequently than others. You might have a meeting with that, and previously it was that those discussions might be a little bit more anecdotal, like, hey, I'm hearing you are denying a lot of these claims, but now we can actually put some numbers to them, and those issues can be resolved in a data-driven way, and the conversations can be a little bit more fluid and guided. So the way you would do that is you click into this pair, and then the tool would break down exactly how the denial populations look for that pair. So I can show that real fast here. And so the one interesting thing that we had with this dashboard is everything is flexible. You can see everything that you would need to see related to denials. And then we've also incorporated this export feature, which is in this corner, which allows for analysts to basically get Excel downloads of the data for further research in their front-end system. So we can bridge the high-level strategy conversations to the case level to find out exactly what the process error might be that's leading to some of these denials. And so moving back into the presentation here, I think we covered how this tool can be used to find exactly what's going on, diagnosing some issues, as well as having more conversations. But you also want to talk about how this isn't the only denials tool that we have. We almost created this suite of denials dashboards that track denials throughout the whole entire cycle. So I just showed the front-end aspect with the upfront denials, but we also have views that take a look at which denials are being written off and the reason why they're being written off, as well as views that detect the immediate difference in denials and try to cover spikes easily.